say anything? What a wonderful introduction. What a wonderful introduction. Thank you very much indeed. The reason why I'm here is because of the marvellous letter that you sent me, Robert. As you can see, I keep it in my coat pocket as a precious memory, and I'd like to read it because this is the reason why I'm here. Dear Professor Ellis, it says, thank you so much for agreeing to come to lecture at Cambridge. The reason why I'm asking you continue, is because you're such a very famous after-dinner speaker.
Never heard that said.
He says, I'm sorry I've given you such little notice. The fact is, I wrote to all the other very famous after-dinner speakers, but none of them would come. Well, you don't have to be Professor Higgins of Pygmalion, Bernard Shaw's Pygmalion, to know from my accent that I'm a Cockney, born and bred in the East End of London. And it's always interesting to find out why it is that anybody you talk to in medicine decided to go into medicine, become a doctor. And in my case, it's very interesting. As I say, I was born and bred in the East End of London, and there's no doubt about it that it was my old GP in Stepney, old Dr. Bishop, who inspired me. And when I was a little boy at school in the East End, I used to walk home and I'd go past the surgery. And if ever I could, I'd pop into his house and look at his books and play with his instruments, which were pretty rusty and old, but never mind. And I used to open his bottles of medicine and sniff at them. And I loved it. And there was a smell. There was a smell about his house and about his surgery and about Dr. Bishop himself that I associated with medicine, healing, and all the things I wanted to do when I was a man. It was only when I went up to Oxford in 1943 as a 17-year-old medical student, I found out what the smell was. It was whiskey. I must say, looking back on I love my career. I love being a surgeon. I loved everything about it. I loved operating. I loved seeing patients. I loved doing ward rounds. I liked experimental work. I didn't like, I must say, I wasn't good at committee work. I didn't really enjoy committee. But apart from that, I enjoyed the whole lot. But if you said to me, is there anything especially that you enjoyed in your career? And I say, yes, there's one thing undoubtedly I enjoyed, and that was playing some part in training young surgeons, seeing a young surgeon, mostly men in those days, but a few women as well, and helping in turning them, pushing them on in their career. That was what I really enjoyed. And what I enjoy now, I've got 12 demonstrators each year, and I think the really thing I enjoy, Wendy, is taking some of these kids and seeing them getting through their Part A MRCS and then going on again their Part B MRCS and feeling, well, you know, I've helped them in their progress. So people say, well, what do you look for in these kids? I say, well, you know, who do you persuade to be a surgeon? I say, I never say, I want you. Do you see? I'm just the teacher that the other people have selected and come through me. Is there anything they say that you look for in these kids? Surely you want to make sure that they're technically proficient. I said, no, not at all. I've never found a surgical trainee where you had to take him to one side and say, you know, you're so clumsy, you'll never make a surgeon. They were eliminated very early on as a house surgeon. When they try and put in their first stitch, it's obvious they're not going to make a surgeon. So you never find a surgical trainee who technically is incompetent. They're all intelligent. They've all got half a dozen A pluses in their A levels. You don't have to bother about intelligence. So is there anything, people ask me, that you look for in these trainees to pick out the ones that are going to succeed? I say, yes, there is. There's one very important thing they have to have, and that is a complete absence of imagination. If you've got too much imagination, you can't be a surgeon. You see, there's the young surgical trainee, young registrar, and a ruptured spleen comes in down to casualty, rushes down to see the patient, says, take him out to the theatre. Supposing I can't stop the bleeding, supposing he bleeds to death on the table, I can't go through with it. But you see, the surgeon with no imagination, this young fellow, doesn't think about it at all. This is an interesting technical lesson in bringing down the congenital adhesion of the spleen to the posterior abdominal wall to be mobilised and stop the bleeding. You know, it's a technical, no imagination at all. I've had trainees who've had to, at the house surgeon stage, with too much imagination. And I've told them not to think of being a surgeon. When I was first professor of surgery at Westminster, ages ago now, I had a nice surgeon, Hedrick, wanted to be a surgeon. So the first time he scrubbed up with me, I was doing a gallbladder. It was perfectly straightforward. Okay, open up the belly, and I picked up a Moynihan's gallbladder for it. Open surgery, none of this fiddling around with tubes. Long pair of Moynihan's gallbladder forceps. I was about to go down like this. He said, "Look out, sir!" I said, "What's the trouble, Hedrick?" He said, "There are a lot of very important structures down there, sir." I said, "Hedrick, have confidence in me. I know they're important structures." A week later, I was doing it was a perfectly straightforward case. It was a vagotomy or something. I opened up the belly again, and Hedrick said, I said, "What are you sniffing at?" Hedrick said, "I think I can smell feces, sir." I think I can smell feces. I counselled him. He's a very successful GP. In Southend, if anybody in Southend, you see Hedrick, he's retired now, so he's a very competent chap. I spent 6 months, shortly after I married Wendy, I was sent to Northampton for 6 months as a senior registrar. And I had a very nice Irish boy, Dick Quirk. I can't remember my children's name, but I can remember Dick Quirk, who wanted to be a surgeon. So we were on take one day, and I was sitting in the mess reading the paper, and Dick Quirk phoned up. He said, "I'm down in casualty." "Harold, I'm down in casualty." I said, "Oh, yes." He said, "There's a head injury here below." I said, "Yes." "He's got a bandage on his head above," said Dick. "What's under the bandage, Dick?" I said. "I daren't look." I daren't look. Too much imagination. I counselled him. He went back to Cork, the GP hemorrhage. You mustn't have imagination as a surgeon. I tell you, I've never said to anybody in the whole of my career, "I want you, this young chap, I want you to train as a surgeon." So I've never persuaded anybody to be a surgeon. I've regretted it in one instance. One chap, looking back on my career, I thought I should have said to this chap, who didn't become a surgeon, I should have said to him, "You would make a perfect surgeon," because he had absolutely no imagination. Being the surgical tutor, one of my jobs was to organise the final long cases in surgery, which I did with tremendous enthusiasm and efficiency. We cleared out the children's surgical ward. We sent all the children up to the children's medical ward, out of the way for the day. And we had a row of empty beds, you see. And we brought patients down from the ward, adult patients down, put them in the rows along like that. And then I had all the MB in Oxford, BM students. Did you wear gowns for finals? They had to wear their sub-fusk with their BA white fur collar, cape as well. And I'd had the list there, you see, and I'd say, Mr. Smith, patient number 1, Miss Jones, patient number 2, Mr. Robinson, patient number 3, Mr. French, 2 little F's, hyphen constant, Mr. French constant, patient number 4, and so on down the road. When I'd finished, French constant came out in his BA gown. He said, "Can I have another?" It was a torture. "Can I have another case?" I said, "What's wrong with the case I've given you? He's dead." So I looked in. I said, "French constant, stand there and don't